is, like I said, we're going to start with mandates and exchanges here on Series 9 of Healthcare Reform. And then we'll go into operation, which is pure administration stuff, and you guys will either love or hate me for that part. Okay, this in the exchange. Now, I want to say at the outset, the exchanges, are sort of the big part of the law, and those go into effect, as you probably already know. This is kind of old news now, on January 1 of this year. Now, there are 33 federal exchanges, 33. The remainder are either state exchanges or they are private exchanges. Now, the federal exchanges, I know, because they're more in the news than what's going on in the private exchanges, but the federal exchanges, which encompasses 33 states. Don't ask me to name the 33 states because I don't know what they are. I know Wisconsin is one of them, and that's where I'm located at. The federal exchanges are not going very well. We're going to get to a point where I'll comment on that, but already, and I mentioned this last on the 3rd too, they've already, for any exchange under 100 employees, if you have a group of 100 employees or fewer, there will be no exchange for you to go on if you wanted to put your employees on the exchange. There will be nothing until sometime at least, and it's not January 1 of 2015, it's sometime at least in 2015. So this thing keeps getting pushed off. Part of the reason is, if you follow it as closely as I do, is there is an enormous amount of communication that has to get out to employers, and then you have to get it out to the employees. And that part's breaking down all over the place. The second thing is the technology that allows the insurance carriers to get on a common platform is a real problem, because a lot of these insurance company, their technology is so archaic, it doesn't talk to the brand new technology that obviously these exchanges have all been built in the last year and a half. So the insurance companies don't easily talk to the exchanges very well. In fact, in some cases, they don't talk at all. So there's some behind the scenes, some real pragmatic problems. So we're going to be talking about this, and I guess I have to tell you that, yeah, you got to obey this stuff to be in compliance. On the other hand, kind of keep your ear to the ground, because, and certainly on Future Office Network, we communicate these things when they break. But it would not surprise me at all if the annual enrollment for January 1 of 2014, which would start on October of this year, October 1, it wouldn't surprise me if they missed that. So that's just my view from the couch on that one. Now, in the exchange, an exchange can offer, through an insurance company, a catastrophic plan. The catastrophic plan would only be available to a handful of folk. Not everybody could get this catastrophic plan. Those that are eligible for a catastrophic plan, now keep in mind that we're talking now in the Affordable Care Act, they're guilty of not always making it clear when we're talking strictly about group health benefits or strictly about individual plans or both. But in this case, they are talking about group health and individual plans. So some of this might not even, if you offer a group coverage to your employees, it may not apply because, well, anyway, maybe it does apply, maybe it doesn't. Let me tell you the rule. Now, a catastrophic plan, if someone goes on the exchange, there will be offered by an insurance carrier at least one qualified health plan. And then if the insurance company wants to market it, they can offer a catastrophic plan. But they have to offer, in that case, too, a qualified health plan and a catastrophic plan. You cannot offer just a catastrophic plan, is my point. Now, a catastrophic plan will only be available to, one, individuals who have yet attained age 30. So people under 30, they're the ones who cannot. So you have to be, if you're under 30 years old, you can go on there. You're not going to meet the eligibility requirements, nor will your employees or anybody that you know. Number two, individuals who are exempt from the enroll or pay penalties because of a hardship. Now, this gets into underwriting, and even though pre-existing conditions are going to be eliminated as of January 1, there will be no pre-existing condition language for anybody. Right now, anybody under 19 doesn't have pre-X, but pre-X will go away completely for everybody. And that is a pricey thing, but it's a good thing for one's personal health. Now, on number two, the hardship they're referring to there, most likely, is somebody who has really got some health problems. They're really, really sick. And so their underwriting would cause them to be so pricey that the price of their health care would exceed 9.5%, which, as we've covered previously, if it's more than 9.5% of that individual's gross income, then that plan would work. It cannot work. The plan cannot exceed, for somebody to enroll in, it cannot exceed 9.5% of the gross income of the employee or of the individual, because we're talking individual and group here. Number three, individuals who would not otherwise have access to affordable coverage. That could really be all kinds of people. I could think of a dozen reasons that would be, but individuals that would not otherwise have access to affordable coverage, they can get can enroll in the catastrophic plan. Now, the catastrophic plan itself, here's what it's going to look like. It's going to have, they're going to be pretty common. Just have different carrier names on it, but a catastrophic plan provides coverage for at least 3 primary care visits per year and the essential health benefits. That's basically the catastrophic plan. It's going to have a high deductible. Now the co-insurance cannot exceed 60% as far as what the employee has to pay. That's a standard rule under the exchanges and under healthcare reform. But it's still going to be kind of pricey, either way you look at it. But at least there's going to be, I'm glad to see from an industry point of view that 3 primary care visits per year. Because some of these catastrophic plans, you got to pay for that out of your own pocket. So this will be paid by the plan. Even though it's a catastrophic plan, you get really sick and you're down for the count, that's when the plan kicks in after you meet this big deductible. Well, this catastrophic plan on the exchange, anyone that you see out there, will have to offer at least, and it can be more, 3 primary care visits. So you get to go to see your doctor and say, you know, it hurts when I do this and that kind of thing. No reimbursement for essential health benefits other than primary care visits in a given year until the individual has incurred cost-sharing expenses in excess of the annual out-of-pocket expense limit for HD-HPs, high-deductible health plans coupled with HSAs. Okay, a lot of gobbledygook there. Here's what they're saying there, is that the catastrophic plan has to offer essential health benefits, but that doesn't mean the plan has to pay for it on a first dollar basis, or even with a low deductible or low copay. In fact, what it's saying is that it can't do that. So the catastrophic plan, even though essential health benefits must be offered in the plan will not pay for those benefits until the individual has satisfied a fairly high deductible. And as you know, here they're pegging it to the individual and or family out-of-pocket expense for an HSA, which is, don't quote, I can't even remember the number right now for what it is, but that's something you can look up very easily. But it changes every year, and it's going up every year. Exchange subsidies. Okay, these are going to be basically, let's share the wealth. The subsidies available on the exchanges beginning in 2014 will be for applicable taxpayers. So here again, we're talking about individual people who are not in a group, but we're also talking about group health care coverage. We're talking about everybody, because everybody's going to have to either be in a plan, have insurance, demonstrate it, or they're going to have to pay a fine. Now, the subsidies are available to all of us, regardless of what kind of health plan we have, as long as we enroll in what's called this qualified health plan. And we're going to we defined that last year, a couple weeks ago, and we'll define it again. If the exchange determines that the applicable taxpayer is eligible, okay, we're going to go through all the requirements of what an exchange has to do, and that's one of them, is to make the determination of somebody that wants to apply for coverage on the exchange. Are they eligible, and by what means? So that's where that sentence is going. The exchange can determine that somebody is ineligible for coverage. But if they determine that the person is eligible, then the exchange will make an advance payment, money, cash, check, of the premium assistance credit to the issuer of the qualified health plan. Now that's the insurance company. So the exchange, the subsidies will be made for certain people that are hard-pressed on the financial side to get coverage on their behalf. The exchange will pay the issuer. In most cases, this is going to be an insurance company, on behalf of that particular individual, so that the individual then can buy the coverage at a subsidized price, and the insurance company's already been paid a certain amount by the exchange. Kind of complicated, but I tried to make that slow and clear. Next paragraph, the applicable taxpayer also will be allowed a refundable tax credit for the premiums he or she is to purchase on a qualified health plan in the exchange during the taxable year, reduced by the payment amount of any advance payment or premium assistance made by the exchange. Okay, what that's saying is that if you look at paragraph 1, where we said that these tax subsidies, the exchange one makes, first of all, somebody applies for coverage on the exchange. They don't have enough money. They're considered eligible for a subsidy, a federal subsidy, a taxpayer subsidy. The exchange makes a payment of that subsidy directly to the plan, the insurance company, and then the insurance company says, okay, Joe or Mary or whoever the person is, you can now get on the plan. You don't have to pay as much as everybody else because of your financial situation. Now that's the advance payment in paragraph 2. But now that taxpayer, that individual, probably has some money. Now depending on how impoverished that person is, they've already gotten a subsidy from the exchange, but they're eligible for another subsidy. And here's how the other subsidy works. Keep in mind, they've already gotten one from the exchange to the insurance company on their behalf. So they're paying a reduced fee for insurance already. Now, they still have to pay that reduced fee. But depending on their financial situation, they'll make that payment every month. But at the end of the year, the taxable year, so it's January through December, some of those individuals will then qualify for an additional subsidy. And what that will be is a refundable tax credit. How is that going to work? Here's how it works. When that individual then files his or her taxes, his or her 1040, on the 1040, there's going to be a place on there that says that they got a subsidy, and based on what their income is and the plan that they bought, a little bit of mathematics goes on, and voila, the government will say you are entitled to a tax credit, not a deduction, a tax credit, which means that it comes right off of their tax bill. which is a good thing for that person, but not necessarily a good thing for the taxpayers who are funding it. And that's what that has to say. Okay, now these we can go through a little bit quicker because you have, I'm going to trust that you already have these down. So I'm going to read these through, make a couple comments on a few of them, but I'm going to assume that you've downloaded the PowerPoint that's already available to you, so you'll have this in hand. But this is what an exchange is going to do. Come 2014, this is what an exchange will do, whether you're an individual or you're somebody in a group plan working for an employer. 1, evaluate and certify qualified health plans. So the plans that you and I as employers buy today from Humana, from United Healthcare, from Blue Cross plan, or anybody, those plans are going to have to be certified as qualified health plans. Who does the certification process? It's the exchange. What are they going to look at? They're going to look at that it meets the requirements of the bronze, the silver, the gold, those or platinum, I should say, the type of, they call them the metal plans. Do they meet the requirements of those plans? Number 2, do they meet the requirements for cost sharing and essential health benefits and a few other things? But basically the criteria that we've kind of gone through over the last months. The exchange will certify, and they'll put a stamp of approval saying, okay, you're a qualified health plan, you can market to the masses on the exchange. Number 2, they'll certify exemptions for individuals from individual enroll or pay requirements. So some people, again, and these are going to be primary people that have either horrendous health problems or really lack the means financially to buy health care plans at the prices that are posted. The exchanges will certify that some of these people, based on those criteria, are exempt from the enroll or pay requirements. Number 3, determining an individual's eligibility for enrollment in the QHP. Well, it's pretty obvious. Looking at the eligibility requirements, do you meet them or don't you? Number 4, notifying individuals of determining and coordinating with Medicaid, the Children's Health Insurance Plan or program, and other programs to implement the determinations. Number 5, enrolling people in the plans. Pretty obvious. The exchanges will have an online enrollment capability so that if you put people on the plan, on the exchanges, or you or I are between jobs or whatever, we're buying an individual plan, and we go on the exchange to do that, we'll have an online enrollment capability that we can go through the screens and get us on there. Appeals process. There is going to be an appeals process if somebody feels that they got something that was unlawful or a raw deal on a claim. There's an appeals process through the exchange. And what is the eligibility determination for that appeal process? That is yet to be established, but that will be part of the exchange. Number 7, keeping accurate accounting records. Yeah, that makes sense. Number 8, evaluating quality improvement strategies. We all know what that kind of means, but what it's going to really mean actually when you see it on paper, don't know yet, because that's being fleshed out right now, and it's not done. Number 9, overseeing implementation of the enrollees' satisfaction surveys. There's a whole bunch of stuff that the exchanges are gearing up for, such as quality measures, something that everybody's talked to as long as I've been in this business. And you probably heard it a million times too, that, how do we really pick a doctor if we're in an HSA or an HRA when we have really no outcomes information? We don't know if a hospital, what their mortality rate is for heart surgeries or whatever, that kind of stuff. Well, I was skeptical about that, but it's starting to come out literally since May 3rd on our last time together, and some of that information is coming out, and so it is going to be available. Now, these enrollee satisfaction surveys, those aren't too hard to create, but that's going to be sort of, again, part of the quality part of the exchange to make sure that we keep the insurance companies on their toes. Number 10, establishing a call center. So consumers, Individuals with individual policies or group plans will have a toll-free number where they can call and get assistance or complain or whatever, something to do with the exchange, or if they need specific information or if they're having a problem with something, there'll be a toll-free number for that. There'll be a call center there to funnel those calls. Number 11, operating an internet website to serve as a primary source of information. Currently, that's healthcare.gov, healthcare.gov. But when the exchanges come online, each one of them will have their own website, and that'll be the authoritative source for disseminating information for that particular exchange. Number 12, awarding grants to the public and private entities to carry out the functions of the Affordable Care Act's Navigator program. Now, okay, there's a couple of operative terms there. Awarding grants to public and private entities and Navigator. The term Navigator in an exchange is synonymous with the person that sold you, your company, insurance, in this case health insurance. The broker, sometimes they're called producers. But the individual who has your account currently, the person that sells you group benefits, group health, when that health insurance is purchased through the exchange, now we're only talking about the 33 federal exchanges. The term Navigator has different meanings in all of the state exchanges or private exchanges. Okay, I want to make this really clear as a bell. So if you're in a state where you are having a federal exchange, okay, take it to the bank. You have the term Navigator, and there are no brokers that can sell insurance in a federal exchange. They're called navigators, and the definition of a navigator is they cannot receive compensation. I don't know how that's going to work, my friends. I really don't know how, because who would do something for free? And that's really basically what they're saying. Now, they're saying these awards or grants to carry out the functions. This is sort of a new thing because in the original law, it was clear as can be that somehow these people were just going to have nothing else to do, but they're going to be extremely knowledgeable about healthcare, and they were going to advise people on what kind of plan designs maybe they should choose. It didn't make any sense. But now there's going to be some money for them to do this, but I have not seen yet where in a federal exchange a navigator gets paid. So to be continued. Now again, if you have a state exchange or if you're in have a private exchange that's available to you or your employees or your friends that don't have group coverage, that may be a different story. Okay, small business health options program called SHOP. Hear me out on this one. I've talked about this before, but this is an example of of a comment that I made at the outset, which was that these exchange programs are not going very well. So let me just read this, and then I'm going to bring you up to speed on what's really going on here. Exchanges are required to establish health insurance options for small businesses. What is a small business? A small business is for the purposes of a shop, a small business is any business that employs fewer than 100 employees. Maybe that's you. Now, if you have fewer than 100 employees, the shop is a type of an exchange. It's a type of exchange. It's on the exchange, but it's a special program specifically for small businesses. Now, here's the deal. If you're a company that has, let me back up for a moment. The original law said that employers that had fewer than 50 employees were exempt from having, from actually even being able to put their employees on the exchanges. The exchanges did not apply to employers with fewer than 50. And that's where you hear, maybe you hear in the wind, you're talking to other employers, you hear people saying, oh man, we got to get our employees down, our FTEs, full-time equivalents, under 50 employees. Now you automatically, if you, like, say you had 80 employees, you automatically could knock off 30. I don't know where they came up with that number, but that's the number. So however many employees you have, knock off 30, and that's the real number you're dealing with. Now, if that number is 50 or more, the law said, past tense, that you would have to offer the exchange to your employees. You have a choice. Here's the new rule. Here's the updated rule as of about a month and a half ago. Any employer with fewer than 100 employees, which is considered a small employer, will not have an exchange available to them until the earliest of some time. The earliest, which means it could be a lot later, sometime in 2015. So there's not going to be an exchange for any employer with fewer than 100 employees come January 1 of 2014. Now, what is going to be in effect is this SHOP, Small Business Health Options Program. But here's what that has been diminished to. It has been, if you have fewer than 100 employees and you decide that you want to put them on the exchange and get out of the healthcare business, you might want to think again for a couple of reasons. Number one is that in the SHOP program, under this, because they got overwhelmed with things, each carrier that chooses to participate in the SHOP, which probably is going to be all of them, will only have to offer one plan. One plan. Now think about that. So right now, when a broker, a producer, an insurance agent, whatever you want to call them, when they come to you and they talk to you and they say, well, you know, we have this plan, we have that plan, we can take it out to market, we can do all these kind of things, we can give you a spreadsheet that shows you all the different options. Well, one option. There only will be one option if you have less than 100 employees and they try to go on an exchange in 2014. It ain't going to be there. Bad English, I understand. It won't be there. It'll be the SHOP program only. And that will only, the insurance company only has to offer one plan. That dog don't hunt, my friends. I don't understand the marketing logic of that and why anybody would want to go to an exchange unless, for some reason, they happen to like that one plan. But there's no choice. There's no comparison of price, nothing like that. It's just one plan. So the exchanges, and I'm giving a little bit of commentary here, but I'm just trying to make some sense out of this stuff, really doesn't seem to be a practical thing to consider for an employer with fewer than 100 employees until such time that the full exchange type concept is rolled out. And at this point, we have no idea when that's going to be for employers with fewer than 100 employees. Okay, enroller pay. We saw that in a couple slides ago that people could be exempt from an enroller pay. And here's what that's talking about. Enroller pay for the individual policy now, so we're not talking group, first of all, it talks about minimum essential coverage. Now, minimum essential coverage is subject to change, but we kind of have a listing of what it currently is. And the minimum essential coverage, the plans that must comply with that are government-sponsored programs, Medicare, Medicaid, our wonderful retired military people that are in TRICARE, which is for the military, and the Children's Health Insurance Program, better known as CHIP. Number two, it applies to eligible employer-sponsored health plans. So these are group plans, probably what you have, which may include governmental plans or any other plans or coverage offered in the small or large group market. Okay, now let's define those terms. In insurance speak, small group is anything under 50 lives. Large group in insurance speak is anything over 50 lives. Now, we've determined already that and these definitions have, unfortunately, they're not all the same, and it only makes this more complicated. We just got done saying that a small employer is anybody under 100 employees for purposes of the SHOP program, and actually for purposes of the exchange. Now, for purposes of selling insurance, the plans themselves, the insurance companies don't think in those terms, 100 or less or 100 or more. They think 50 or less or 50 or more. Okay? So that's what this point number 2 is talking about. So minimum essential coverage applies to group plans 50 or under or 50 or above, small or large group, within a state, including self-funded plans. So if you have a self-funded plan, this applies to you, provided that the employee's share of the premiums is affordable. What's affordable? 60% is the most that you can, is the least that the employer can pay as a part of the monthly premium. So if you have a plan that requires an employee to pay more than 40% of the premium, you're out of bounds, and you're not in compliance with PPAC at that point. So that's what affordability is. The other affordability feature is the 9.5%. And that one gets a little bit more dicey because you have to kind of get into things that we, as employers, never had to do before. But now you have to say at an individual level, does anybody here in my company, your company, the plan that we're offering or the plans we're offering or the plan that they pick, is the cost, the total out-of-pocket cost in a given calendar year, does it exceed 9.5% of their gross total income? If it does, it's unaffordable. And here they're saying it has to be affordable. Okay, we beat that one to a pulp. Minimum essential coverage includes continuation, which is COBRA, or if it's under 20 employees, many of the states, if not most, have state continuation coverage. That is considered minimum essential coverage. Grandfathered plans, including those that are self-funded, and individual plans, health plans, including a plan purchased through an exchange or outside of the exchange. So any individual health plan is subject to the individual enroll or pay. And that, just for purposes of clarity, means that individuals have to enroll in one of these plans on this particular slide. And if they don't, then they have to pay a fine. That's the pay or play concept. Okay? Now, minimum essential coverage will not include. So an individual has to get health insurance, and if they don't, then they have to pay a penalty. Pay or play. Now, this kind of goes without saying, and it's kind of dumb that we even have to talk about it, but we did say we're going to do soup to nuts. So an individual, if they have any of these coverages, these do not constitute minimum essential coverage. So if they've got coverage only for accident or disability income, that's not what we're talking about. No. If they have that, that's not considered to be health insurance. So therefore, there is no pay or play. If somebody has a supplemental liability insurance policy, no, that's not health insurance either. You got to get health insurance, pay or play. Liability insurance, forget about that. Workers' comp doesn't count. Automobile medical payment insurance doesn't count. Credit-only insurance, I don't know why that's in there, but that doesn't count. Here's an interesting one, coverage for on-site medical clinics. That doesn't count. That does not constitute health insurance. Now, the weird one about that may not apply to anybody on this call or anybody hearing this on recording, but there's a lot of larger employers have on-site medical clinics. I know of a bunch of them that I've consulted with over the years. And they have tremendous benefits that would qualify as essential health benefits and qualify under PPACA because they're the preferred plan that they want their employees to take. Now, oddly enough, that coverage, if you have an on-site medical clinic, if you're in that, that does not constitute health insurance. And therefore, you're going to have to get an additional health insurance policy, or you're going to have to pay a penalty. That one's kind of weird, my friends. Lastly, other similar insurance under which benefits for medical care are secondary or incidental to other benefits, kind of a catch-all phrase. Now, here are the penalties. Any individual who is required to enroll in a minimum essential coverage and chooses not to do so must pay a penalty to the federal government. Now, those penalties, by the way, whether they're employer or individual, are not tax deductible. This is the first law that has dealt with benefits where fines or penalties are not tax deductible. For example, penalties under ERISA or any other benefit law, even though you got to pay the fine or the penalty, they've always been tax deductible under Section 162, which is where businesses take deductions. They're non-deductible. Now, there's a couple of exemptions to having to pay the penalty, and here's what they are. People that do not have to pay the penalty are those. Number one, individuals whose required contribution for the lowest cost option that they're offered would be in excess of 8% of household income. Now, you just got done hearing me say that it's 9.5% of total out-of-pocket costs. If it exceeds that by $1, 9.5% of gross income, not adjustable, gross income, that would not be a PPACA plan. Now they're using the term 8%. Now, the key is in the wording. The 9.5% applies to total out-of-pocket costs. If it's more than that, it's unaffordable, and it's PPACA is going to get mad at you. Here, they're saying the required contribution for the lowest cost plan. What is the contribution? It's the monthly payment. It's the employee's monthly payment just towards the premium or the premium equivalent. If that exceeds 8% of their household income, boom, penalties don't apply. Number two, penalties don't apply to individuals who do not file a 1040 because they did not earn enough money to have to file a 1040. That's the end of that tune. Number three, penalties do not apply to individuals who were not covered by minimum essential coverage for a continuous period of at least 3 months. Once the continuous period without minimum essential coverage reaches a period of 3 months or more, this exemption expires at the penalty, and the penalty applies retroactively for the entire period. Oh boy, what does that mean? Okay, what that means is that there basically is a loophole. There's a loophole that is lawful in the law that says, you know, on this pay or play thing, or enroll or pay, it's really the same thing, just explained a different way, that any one of us, anybody, we can go 3 months without having coverage and not be penalized. However, once we go 1 day over 3 months, then, kaboom, the rule applies retroactive to the first day of the 3-month period that you went without coverage. I know this is confusing. So you got 3 months you can go. You're in between jobs, and you know you go, oh man, I gotta get health insurance because that's what the law is now. It's a tax if I don't. I have to pay a penalty. Don't worry about it. You or your employees can go 3 months, but not more. But you can go 3 months without coverage, and nothing's going to happen to you. 1 day over 3 months, kaboom. Then the law says it's retroactive to the first day of the 3-month period, and you would then have to pay or either pay a tax to the government for the entire 3 months or more that you've been off, or you have to get health insurance retroactive to the beginning of that. Now, that's not possible, is it? Nobody's going to give you a policy retroactive back to the first period, unless you're within COBRA and you're within the 60-day period, right? You have 60 days to make up your mind under COBRA, which is group coverage, to make up your mind when you drop off eligibility or you terminate from an employer for reasons other than gross misconduct. At that point, whenever the qualifying event is that you lose coverage, you have 60 days to make up your mind under the COBRA law of 1985, Consolidated Omnibus Budget Reconciliation Act. 60 days to make up your mind. Now, if you're healthy, what a lot of people do is they call ride the float. I've done that. I've quit an employer, I've been offered COBRA, and I felt confident, and in fact, that I did get a job within 60 days. So why should I go and get on COBRA? I didn't have any health problems. Yeah, I was taking a risk, but my risk was if I got sick, I'd go to the doctor. It simply meant that I'd say, okay, I'll take COBRA now. And it would be retroactive to the first day of the 60-day period. Well, here it's 90 days. Well, it's actually 3 months, which might be more than 90 days. If you have a question on that, I threw a lot of stuff at you on that little one. And that one's kind of complicated because it brings into play COBRA, and it also brings into play HIPAA, actually, because HIPAA has a rule that you cannot, for pre-existing conditions, you cannot go beyond 63 days. Now, that one's going to go away. The 63-day rule will go away on January 1 because there'll be no more pre-ex to apply. Okay, number 4, individuals who do not have an affordable coverage option, either through an employer or through a qualified health plan, which could be an individual policy certified by the exchange. If you don't have one of those, then you don't have to pay a penalty. If you don't have access to something like that, well, no, they're not going to penalize you. And then members of Indian tribes are exempt from penalties. Here are the penalties. The penalties for not having minimum essential coverage are calculated on a monthly basis, okay? So you look at the numbers. 2014, the individual dollar penalty is $95 per month. Per month. Now, that doesn't mean that a person who decides to pay the penalty and doesn't want to get health insurance has to cut a check every month for $95. In fact, what the law says is it's calculated monthly, but it's paid on an annual basis. So it's 12 in this case for 2014. Next year, it'll be 12 times 95, so just under $1,200 a month, a little bit less than that. 2015, it jumps considerably, $325 a month. 2016, $695 a month. Now we're starting to get into some significant money for anybody who decides that I'm not going to take health insurance, I'll pay the penalty instead. Monthly, but it's going to be one check that you will pay at the end of the year. Now, the penalty calculated is the greater of the set dollar amount or the percentage of household income that exceeds the dollar threshold required to file a Form 1040. Think about that one. That one's a little bit hard to, that's a complicated one, but that's the rule, and that's how it works. Now, down at the bottom of the slide, it says the individual dollar penalty is for individuals. It's for persons. It's not for a group. It's each of us are accountable as individuals to pay this. And we have to be at least 18. If you're under 18, you don't have to worry about that. And the age 18 counts at is determined to be 18 if you're 18 at the beginning of the month. Okay? So if you're 18, like my birthday is on the 23rd of a month, so if I chose to pay the penalty when I turned 18, only in my dreams, but it would be the following first of the month that actually the penalty would apply. Now, for those people that have not attained age 18, they're 16 or they're 15 or whatever, the individual dollar penalties are reduced by 50%. For a family, the sum of the individual dollar penalties cannot exceed 300% of the values in the table. Okay, what they're talking about there is that if you or I or one of your employees has family coverage, if somebody in their family is under 18, the penalty is cut by 50%, but there still is a penalty if you as the parent choose not to cover your dependent kid or kids with health insurance. But if they're under 18, they're throwing us a bone by saying, well, we're only going to charge you 50% of the penalty. But there you see the penalties in the table. That's what's going to apply, and that probably won't change before 2014 if it changes at all. Penalties effective January 1, 2014. Individuals subject to pay or play, enroll or pay penalty must remit to the payment to the IRS. While the penalty is assessed on a monthly basis, payment is made annually, administered through the Form 1040 tax return. Okay, so that's how it's going to work. You're either going to have to write if on your 1040 if you get money back from your taxes. Well, whatever the penalty was, if that's the route you chose to take, the amount that you get back off of your 1040 will be minus the penalty. If you owe taxes, you will owe the taxes plus whatever penalty is assessed against you. So your tax liability will in effect go up because the Supreme Court said all these penalties under PPACA, they are in fact a tax, and that's a legal term. Taxpayers who fail to remit in an enroll or pay penalty, a pay or play penalty, will be subject to interest and the traditional IRS penalties for underpayment of tax. It sounds like a nasty situation. I don't think none of us want to go there. Okay, certain employers must offer minimum essential coverage or pay a tax penalty. That's what we've been talking about for the last 15, 20 minutes. Now, I put this on here only because it's a nice tool. Today, actually, we have some new features going up on this one. But if you can just go, you can go right on that link there, or you can just go on Google and just type in pay or play. We happen to be the #1 pay or play calculator. It comes up #1 in Google. It's a pretty nice piece. It doesn't cost you anything. It's free, so use it. Now, I want to stop here and talk about a matter that is not in the PowerPoints, but we're getting into, we've already started talking about some issues here that I want to give you some advice. When I talk to employers, and I talk to employers a lot, and I'm talking to employers right now, you guys, one of the things that I hear consistently, not always, but I hear it a lot, and it's a consistent strategy. And if you're considering this, then please hear what I have to say. A lot of employers are going, if I can get my FTEs under 50 employees, then I can really, at least for the time being, I can get out from underneath this PPACA responsibility and this shared responsibility where I got to offer this big plan and all this stuff and pay penalties and all of that stuff. So a lot of employers are saying, I've got to get my FTEs, full-time equivalents, under 50 employees. Now, some of those employers are right around the 50 mark. They're like 55, or they're 60, or they're more. And so one of the things that they start to consider is looking at those employees who are not full-time, in some cases are full-time, but they're saying we're going to take them under 30 hours. We're going to reduce their hours because that will reduce our FTEs. Well, that's true. You will. And they rightfully think that if they get their FTEs down under 50 by reducing the hours of some of their employees, maybe somebody's working 33 hours or 35 hours a week, and they go, we're going to cut your hours and bring you to under 30 hours because under the terms of our plan, that then drops you off the eligibility list. Now, that varies. You might have a plan where the eligibility is 25 hours, right? All employees at 25 hours or more have to be on the plan. Usually it's 30 hours, but it depends. You have to look at your plan. Now, if it's 25 hours, then you have to get them under 25 hours. This may not be a wise strategy at all, and yet there are so many employers across the country that are considering this that I want to tell you about something that can come and really bite you. It's called ERISA Section 510. Now, if you haven't heard of this, please listen. If you are aware of it, bear with me and humor me. Now, Section 510 of ERISA is something that doesn't come up a lot because ever since ERISA was written, it's been in the law, but we've never had a real carte blanche reason to apply this particular provision. But here's what the provision says. I'm going to be doing a SmartCast, which is not an HRCI certified, but it's just one that you guys can attend. Anybody can attend these. It's going to be in August. I'm going to be talking about this and a few other issues. But let me tell you what it is, because it applies to what we're talking about today. Section 510 of ERISA. Let's back up. ERISA says, right at the very, very beginning of the law, ERISA says, ERISA, the Employee Retirement Income Security Act of 1974, applies to all employee benefit plans. That's it. And then there are some exemptions. It doesn't cover to payroll practices like short-term disability, if in fact you don't insure it, other things. But forget about that for the moment. It does apply to health plans. It does apply to health plans, and that's what we're talking about. What does 510 say? 510 says that, first of all, under ERISA, participants in a health plan have a legal right. It rises to that level. ERISA says that participants in a health plan have a right, a legal right, employee rights, to enjoy all the benefits that that health plan provides. Furthermore, employers cannot interfere with an employee's right to enjoy the privileges of the plan that they are a participant in. Employers cannot interfere with that right. If they do interfere with that right, the employee and then it refers to a different section of ERISA called 502. You have to remember that. Remember the language part here. But if you interfere with an employee's right to participate in their plan, the employee then can bring, one, a civil action against you. They can sue you. Number two, the DOL, and this is probably the bigger one, because the employee may not have the wherewithal to bring forth a suit, but they can legally. The bigger one is the DOL will come and pay you a visit, or they can come and pay you a visit, and they probably will because they have to enforce ERISA. And they can assess a penalty, a fairly big penalty. It'll get kind of nasty for you if they determine, one, that you've interfered with the employee plan participants' right to their benefit plan. Okay, now that's number one. Just let that sink in for a second. Here's the second part of what 510 of ERISA says. Section 510 of ERISA says that it is also prohibited for an employer to retaliate against a plan participant for seeking to enjoy his or her rights as a plan participant in the health plan. Now, how does that, let's break that down into practical terms. Let's just say that some employee plan participant in your health plan, or anybody listening to this, makes some kind of a stink about all this kind of stuff, or says, I was working 33 hours a week. You cut my hours back to 28 hours, and I'm really ticked off because now I can't be in the plan anymore because I've dropped off the eligibility list. Get it, my friends? Now, you could say, well, that was for business necessity. Who are we trying to kid? Would that really come out if in the course of discovery, legal discovery? No, that's not what you're really doing. What you're really doing, and if not, I'm not saying you people, but what a lot of employers really are doing, in fact, is they're cutting people's hours, dropping them off the health plan. By the way, they're making less money now because they're getting paid hourly, presumably. They're not going to be happy campers. You are in a, I keep saying you, employers that would do this, and hopefully it's not anybody listening to me on this call, employers that do that are in fact interfering with the employee plan participant's right to their benefit. In fact, you've cut them off. What you've done is you've created a subterfuge to avoid the purposes of the Affordable Care Act. That's that's civil action, and that's a bad thing. That's penalty number one. So now the employee complains to you. Now let's just say that somebody's kind of hot-headed and they complain to you and they really kind of come off half-cocked, and they go, "You cut my hours here. I'm not on the health plan. This place isn't what it used to be. I think this is really an awful place to work. Ah, rah, rah, rah. I can't believe you did this." And in exchange, it's more and more heated. Is it possible, is it probable that some employer may say, "Listen, if you don't like it here, why don't you just quit?" Or, in fact, "You're fired," or something like that. Now, the potential exists for that to happen. I hope you'd agree. That's called retaliation. That's the second violation. One is interfering, cutting their hours, going part-time. If that's the only reason that you cut your hours, that is interference under Section 510 of ERISA. Believe me. We never heard about it. We never talk about this. But it has suddenly come into the wherewithal. Now, some of you know that I write a monthly column in Employee Benefit Advisor. I'm actually, my June column that will come out June 1st. Is all about what I just got done telling you. So you can wait, you can read it and digest it that way. But if the employer then retaliates against the employee for complaining, and they're complaining basically because they're saying, "You know what, I have a right," an attorney would say, what's really going on here is they're complaining about their right to their benefit that has been taken away. If you have no other reason to justify why you've taken somebody part-time, my friends, you're going to probably be found guilty of avoiding the act. In this case, ERISA. And the civil penalties, lawsuit can apply, and the DOL penalties can apply. So, if you or anybody listening to my voice is considering that kind of a strategy, don't do that strategy alone. You can cut somebody's hours for business necessity, but you can't cut them just to get them off the health plan. That's a dead ringer to kick in 510 of ERISA. Okay, thank you for bearing with me on that. But that is so important, and that is what attorneys are talking about today, and they're licking their chops. Employer health plans effective January 1, 2014. Certain employers will be required to offer full-time employees a chance to enroll in employment-based health plan coverage that satisfies the definition of minimum essential coverage. Who are the certain employers? They're employers of 50 or more. Applicable employers that fail to provide minimum essential coverage to any full-time employee, and full-time is going to be defined either by statute at your state or it's going to be defined as full-time in the actual language of the insurance contract, the insured plan that you buy from an insurance company. Either one will define full-time employee, and they may not be the same. But whichever one is lesser is the one that's going to rule the day. Through the exchange, and will be subject, if you don't do this, a non-deductible federal tax penalty. The calculation of the penalty varies depending upon whether the employer is offering the minimum essential coverage. If you're not doing that, that's one penalty. If you're not offering it to all full-time employees, that's another penalty. And it includes full-time employees covered by collective bargaining agreements. Now, I've heard differing things on collective bargaining agreements. The one that I seem to read the most from attorneys, I'm not an attorney. I'm not giving legal advice here. But when I read here about if you have a collective bargaining agreement, is that the collective bargaining agreement does stand until the collective bargaining expires. And at that point, any new negotiations for the new collective bargaining agreement must have this language in there. That'll have the CBA, the collective bargaining agreement, will have to take into account all the rules under the Affordable Care Act because they do apply to union employees. Applicable employers, pay or play is applicable only to large employers. Okay, now here's where we use these different numbers again. We employ on average 50 or more full-time employees on business days during the preceding calendar year. For a new business, or one that hasn't been in existence for an entire preceding calendar year, an upstart, the large employer determination will be based on the average number of employees the business reasonably expects to employ on the business days during the current calendar year. And that one sounds like it's open to lawsuit and interpretation. What does it mean to be reasonably expect how many people you're going to employ? When you're a startup, and I've been there 3 times personally, I started 3 companies, and it's very difficult to anticipate staffing. So hopefully you can appreciate that. So that's the rule. I don't know how they're going to enforce it. It sounds like, I hope I don't get caught up in that one. Here's a bullet point. An employer will not be subject to the pay or play rules if during the preceding calendar year, 1, it employed 50 or more full-time employees for 120 days or less. Okay, so there's a lot of companies out there that have contingent workers. I was with an employer not too long ago who has a lot of employees, but these employees are seasonal. They only work in the summertime because what the company does is they do lawn care. So these guys go out, they fertilize the lawn, and put stakes in the ground, and make the trees grow nice, and that kind of thing. So this is an exemption. If your workforce balloons to more than 50 full-time employees for less than 120 days in a year, well, you're not considered to be eligible for the pay or play rules. Now, the controlled group rules here do come into play, and this is important. So even though you might be one company that does not employ more than 50 employees full-time for 120 days or more, if you are owned by a controlled group, which is like this management head that owns a number of companies, remember they set up, perhaps they set up a number of LLCs or things like that, then that does not exempt you from the PPACA. Now, a lawyer will tell you, don't try and determine a control group yourself. And I'm not an attorney, so I'm going to defer to what the lawyers say, but I'm also understanding that lawyers see that there's an opportunity here. My take is I have read 414B, C, and M, and O of the Internal Revenue Code, and my take is, as an educated layperson, just like you folks, you can make that determination. It's not too difficult to understand. I'm looking at the clock here. It is 12:38. We are now over by 8 minutes, and so I was afraid of this. So we are going, please be watching on davidsonmarketing.com. We are going to, we've got about another 5 or 6 slides to go, but it's not the slides, it's the depth of the content that I have to go through. So we will be scheduling another, the next one we will do, we'll pick up from where we're at right now, and we'll be posting that with the material that we're going to cover in that one. And hopefully you guys will sign up for that one as well. So are there any questions from anybody in the group here that I can answer? Raise your hand or type them in on the thing on the bottom, and I will be happy to take care of that for you. Particularly that 5-10 rule, I would think that might have some questions. That's a pretty nasty thing. Okay, I don't see any questions. Make sure you download the materials here, and we'll be picking it up from here in the next one, which will be before the end of the month. But check davidsonmarketing.com under the webinars under FONHR, and that's where it'll be. Thank you very much, everybody. Sorry you didn't have any questions. I would have loved to have talked to you, but we will talk to you very, very soon. Have a good day, everybody. Bye.